I am Chiara Cremolini. I'm a medical oncologist at the University Hospital of Pisa, and I am a member of the GI Connect team. I am happy to share with you some interesting news of the ESMO 2021 Congress that has just been concluded, and I have selected some abstract for you. In particular, I have selected three abstracts that have been presented as oral presentations: the ATESO-TRIBE study, the MAIA study, and the CRYSTAL-1 study, and then three trials in progress that may be interesting in the next future that are named ReProgram 1, Regina, and Surrogate. With regard to the first two trials, ATESO-TRIBE and MAIA, they are somehow linked by a fil rouge, which is the objective of making immune checkpoint inhibitors efficacious also in the vast majority of metastatic colorectal cancer, which are microsatellite stable. In the ATESO-TRIBE, the combination of folfoxiri plus bevacizumab plus atezolizumab was investigated as upfront therapy in previously untreated metastatic colorectal cancer patients and compared with the folfoxiri plus bevacizumab. The primary endpoint was a progression-free survival, and the primary endpoint was met. Patients treated with atezolizumab achieved longer PFS as compared with those who received the standard folfoxiri plus bevacizumab. There were no main issues in terms of safety because chemotherapy and bevacizumab-related adverse events occurred within the expected frequency, and also immune-related adverse events were quite rare and not clinically relevant. And an interesting data comes from the subgroup analysis, showing a significant interaction effect between MMR status and the treatment arm. In particular, the effect of the addition of atezolizumab was clearly higher among patients with deficient mismatch repair tumors. This is quite expected, but patients in this subgroup treated with folfoxiri, bev, atezo showed impressive results in terms of PFS. However, also in the larger subgroup of patients with pMMR tumors, still there is a signal of efficacy for the addition of atezolizumab. Translational analyses are ongoing to better identify who are these patients who benefit from checkpoint inhibitors. In the MAIA study, another strategy was put into action to make immune checkpoint inhibitors efficacious in MMS tumors. Patients with MGMT methylated and no MGMT expression at immunohistochemistry were treated with temozolomide as a priming effect to make these tumors more similar to MSI high tumors. And then patients achieving at least stable disease with temozolomide were treated with the combination of ipilimumab and nivolumab plus temozolomide. Also in this case, which is a phase 2 single-arm proof-of-concept trial, the primary endpoint, which is the 8 months progression-free rate, was met, clearly showing signals of activity for this combination, at least in a small subgroup of well molecularly selected patients, and thus making this strategy worth of further investigation in new strategies. In the landscape of making checkpoint inhibitors efficacious in MSS tumors, an interesting trial in progress has been presented. It is called Regina in locally advanced rectal cancer, where patients that are today candidate to a neoadjuvant therapy will receive a short course radiotherapy plus regorafenib and the anti-PD-1 nivolumab. Moving to the later lines of therapy, today we have two options with the phase 3 evidence, trifluridine and regorafenib. There is an interesting French trial, Surrogate, investigating the sequence of regorafenib followed by trifluridine versus the reverse strategy. But also in this treatment setting, we have some interesting news. In particular, the CRYSTAL-1 study that investigated the anti-KRAS G12 C adagrasib with or without cetuximab. This was not a randomized trial, but a phase 1b and then phase 2 trial in pretreated metastatic colorectal cancer, showing signals of activity for adagrasib alone, 22% of response rate, but even more with the addition of cetuximab. We have not yet results in terms of duration of this response or disease control that approaches 100% with the combination of adagrasib and cetuximab, but for sure this combination needs new studies to enter our daily clinical practice, and is really interesting with regard to results that have been up to date provided. Again, also in this treatment setting, the advanced lines of therapy, there is another interesting trial called Reprogram that has been presented as a trial in progress, trying to exploit the anti-angiogenic and immunomodulatory properties of metronomic chemotherapy in combination with regorafenib to achieve efficacious results also in the subgroup of chemorefractory metastatic colorectal cancer patients. More details about these trials are available in the slide kit, and I thank you so much for your kind attention.